Hey, welcome back, man. Big Money Bound TV, RRT Posse. If you're new to this, go ahead and hit the subscribe button, hit the like button, drop some comments. But if you're true to this, you see the headband, then you already know what's going on, man. I'm dropping 2 videos in one day, once again. Ain't nobody doing this like me. What I'm doing today is Q&A part 2. Y'all been leaving all them comments, answer this, answer that. I've been saying, hold on, I got you. And hey, I got you. We doing this right now, man. Let's go ahead and get it started. Live life high. They had a question. Live life high. Hey, man, you gotta let us know what that means, cause we are RT Posse, man. You know, we medical field staff, like we saying no now. We saying no. So when you say live life high, you mean like the sky's the limit, or you mean like I get so high? You gotta let us know. All right, the question they have is, talk about what kept you going throughout the program, and is it really as hard as people say? What kept me going throughout the program is really that struggle, man. Like hard times, like just knowing that things were gonna get better if I graduated, if I got a career. Once I got my respiratory therapist license, and I could make more money per hour. So that struggle that I was in, that's what kept me motivated to keep going. That's what helped me get through it, man. It just kept me going throughout the program, just like knowing that it was light at the end of the tunnel, knowing that eventually I was gonna get to them riches, man. Eventually I was gonna be where I am today. So that struggle just kept me going, bro. That's just, I'm just being 100 with you. Is it really as hard as people say? When anybody ever asks me, is it hard? Like, it's doable. You feel me? Like, it's doable. Because everybody's level of difficulty is going to be different. For me, if I'm studying more than you are, you're going to have a harder time than I am. So it all depends on like how much you're willing to put into it. If you're willing to put like your all into it, you got nothing but free time, you don't got no job, you ain't got no relationship, you ain't got no kids, it should be sweet and easy. Because you got nothing but time to like study and really focus on your schoolwork. But now if you got a job, you got multiple boyfriends, multiple girlfriends, you living how you living, you got kids, you got family messing with you, then yeah, you're going to have more of a harder time than somebody who doesn't have all those distractions. So that all depends on like really how busy you is. All right, the next question. Second start SRT. Hey, y'all let me know what SRT means. I'm assuming that's student respiratory therapist. Just drop a comment, let me know if I'm correct. All right, second start SRT wants to know, what is your favorite part of the hospital to work in? My favorite part of the hospital to work in. To be honest, I just don't like to work. I don't like to work in like one area every time. So like, I don't really have a favorite area. My least favorite though is like pediatrics. That's my least favorite. Now I can do it, but you see a little 2-month-old or 3-month-old, you gotta go grab somebody's baby from them, put the baby on their side, do CPT, do blow-by treatments, baby screaming and hollering. They not telling you what's wrong, they just screaming and kicking and fighting and punching. So that's why my least favorite is pediatrics. But when it comes to my most favorite, as long as I'm being rotated throughout the whole hospital, man, the floors, the units, the ER, I'm cool. Like, I don't want to be in ER every day. I don't want to be on the floor every day. I don't want to be in the unit every day. I just like to just be able to float and rotate through, you know, just bump on through the hallways, go here, go there. I'm known over here, known over there. So that's me. So I don't really have a favorite part. I like it all. What was the biggest surprise about the job that you learned when you were in school? Okay, my biggest surprise. I didn't want to become a nurse because I didn't want to stick people with needles. I thought respiratory therapy, you know, was all treatments, all ventilator care, all of that stuff, man. I ain't know nothing about no needle sticks. I say about 6 months before I entered into the program, I was talking to the therapist at my job. He was like, yeah. I'm like, yeah, man, I want to be a respiratory therapist because I don't got to stick nobody with needles. That dude said, what? We got to do the most painful needle stick there is. Arterial blood gas. I'm like, we got to do what? He like, yeah, man, we gotta stick a needle right here. Oh Lord, man. But by the time I found that out, bro, I was in too deep to turn around. So hey, I was going, hey, stick them up. Stick them up, stick them up. You feel me? Like, stick them up. So that was like, really, that was a big surprise to me. I didn't know I had to do no needle sticks, but now I'm like the best person at doing ABGs, man. I am the best. I remember when I was a student at the schoolhouse, when I was in a program, we was practicing the blood sticks on like a mannequin. We was all just pumping, you know, you had to like pump a little ball to get the blood flowing throughout the fake arm. And my teacher was trying to get a blood gas, but she couldn't get it. She was like, wait, is that something wrong? I was like, let me try. And then like, I got it. But when I got it and I saw the blood flash through, I just dropped it like, yeah, I did it. She's like, no, don't do that. She's like, you gotta hold it. Oh, my bad. I was just so excited. So yeah, man, I'm real good at ABGs now, man. But at first, bro, that was my biggest surprise. I was like, man, I don't want to hurt nobody. Oh, man. But now, I can do it in my sleep. I wouldn't, but I could. Javonda SC. What's happening, man? You a loyal subscriber? Thanks for the comment. Is there a lot of paperwork in respiratory therapy? Yeah, it's a whole bunch of paperwork, man. Whole bunch of like computer work, computer document. Every time you give a treatment, you got to document. Every time somebody refuses the treatment, you got to document. And in your documentation, it's good to say, patient refused treatment, nurse aware. You let it be known that you did notify the nurse. A patient refused a blood gas. Same thing, patient refused, nurse aware. You come back, you got ventilated patients, you come back to the ventilator, the doctor don't came and change your vent settings. You don't know how long they've been on. Hey, came back and found patients on these settings. They were set by the doctor. So you let them know that it wasn't you that changed the vent. Check the documentation. That was the doctor. Anything go wrong. Because you got to document really to cover yourself and protect your license, man. That's first things first. And what else paperwork we got? You know, you got the ABG scripts. That's paperwork. That's actual paperwork. But like computerized, it's all like, yeah, documentation. Just covering yourself. Let them know what you're doing. Every time you scan a treatment, every time you give a treatment, why is this treatment late? Why is this treatment early? You got to do all that, man. So yeah, it's a lot of paperwork. Anytime management tips. Yeah, man. Don't procrastinate. Start when you can start, man. Don't assume, oh, I only got 13 patients, whatever. That's going to be nothing. That's going to be nice and easy. So I can start at 8 o'clock instead of starting at 7. I can start at 8:30 instead of starting at 7. You go out there at 8:30, thinking you got one 8 o'clock treatment. As soon as you step outside your department door, rapid response. Now you got to go over there. You missing your 8:30. Code blue. Now you really stuck over there. You missing your 8:30. So don't procrastinate. Really give yourself time to have free time. If you finish everything early, everything on time, you like no emergencies came up, no phone calls. Now you created downtime for yourself. You deserve that. Kick back for them 30 minutes, 45 minutes. Just relax, get your head right, and think, yeah, man, I'm a therapist, not all like, yeah, RRT posse, we in here, you feel me? So yeah. Tia San. That's the next question we got from Tia San. Tia San, what's happening, man? Welcome to RRT posse. That's a new name I ain't familiar with, but welcome. How long was school and internship? All right, the school was 2 years. I like to tell people 4 years, man, because it was 2 years to get your prereqs and 2 years for the programs. That's 4 years to me, man. The program was 2 years, but in total, that was 4 years. The internship was like, it was throughout the program, so it was probably like a year and a half. We probably started doing the internship the second semester, or midway through the first semester, so about a year and a half. Next question she asked, are you certified RT or registered RRT? I'm both. I'm both of those, dog. Yeah, I'm dual. How? Let me explain that to you. Because when I took my state board exam, in order to take the registered RRT exam, you had to first pass the certified RRT exam. It was one test, but you just had to like get like a certain cutoff score. The same way they do it now. You had to have a certain score that pushed you into that RT bracket. But once you got there and you hadn't taken your SIMs yet to become an RT, they sent you a certified RT license in the mail. So Technically, I'm both of them. Which one do I use? The registered RRT one, of course, but I am both of them. Good question, man. NV, what's happening, shorty? Welcome back, man. Thanks for dropping the comments. You're a loyal subscriber. Keep up the good work, man. RRT Posse, you know we in here, man. Mercedes-Benz. I've come across a lot of RTs complaining about bumping heads with RNs. Have you experienced this? What's your point of view? Man, really, like, I don't know, like, ever since, like, everybody's trying to make it, like, some kind of beef between RTs and nurses, man. Like, bro, I love the RNs, man. I love them nurses. And they love me, man. Like, it's all love. You feel me? Like, of course, you got people that you just gonna, like, people gonna bump head with people. So you got the environmental staff bumping heads with the nurses, the environmental staff bumping heads with the docs, bumping heads with the therapists. You got transporters bumping head with the nurses, bumping head with therapists. Like, everybody sometimes, bro, everybody got a little conflict going on. It ain't just RTs and RNs, bro. But sometimes, yeah, you know you're gonna bump heads with people. You got some RNs, mostly like they're a little older. They kind of stuck in their ways. They believe that they work for the doctor and you work for them. Nah, bro, like, I don't work for you, bro. First thing first, I work for money. That's first thing first. Secondly, I work for the field, my license, the healthcare. That's first things first, man. I don't work for you. Oh, you work for y'all? No, I work for money, dog. No, don't disrespect me like that. No, ain't nobody over me. Hey, ain't nobody over me hurting me saying get to work, get to work. Nah, I'm working. That's the dollar that's whooping me. Ain't nobody else talking crazy to me, man. So some nurses believe that you work for them. Then there's some cool younger nurses that understand, man. We all part of the healthcare team. We all part of the healthcare staff. We're here for the patient. Of course, we're not here for free. We're here because we get paid. But in order to get paid and get our money and get our checks, we gotta do our job. Our job is taking care of the patients. So that's who we here for, man. We ain't here to make friends. We here to make a living by taking care of these patients. All right. Erasmo Bustos. Erasmo Bustos. I hope that's right, bro. Hey, I tried, dog. I tried. His question is, how do you mentally and physically prepare yourself? How do I mentally and physically prepare myself into taking the steps I need to be ready for my journey? You prepare yourself just by knowing that it's not going to be easy, but it's doable. Secondly, by watching my videos, because I'm letting you know it's doable. It's going to be some bumps in the road, but hey, it's possible to get through it, you feel me? So you just tell yourself, man, like, it's going to be hard times, it's going to be up and downs, but as long as you stay with it, you stay strong and stay committed, you can make it out, because there's respiratory therapists in the field. So everybody had to go through it. Everybody made it out at some point, man. Just stay strong, keep a level head, you can make it happen, bro. Next question he asks, did you have family/friends making you feel you weren't good enough while you were in the program? Did I have family or friends making me feel like I wasn't good enough? Nah, I didn't feel like I had nobody making me feel that way. But someone could have been trying to make me feel that way. But like my self-esteem, like my drive, my ambition, my vision in my head wouldn't allow anybody to like discourage me or make me believe that I'm not good enough. Because I knew in my head that I was good enough to make it happen, and I was going to make it happen, and I was going to see the riches. I was going to get to that Fetty, and I was going to really change my life. So no one should be able to make you feel that way if you feel like so much confidence in yourself, man. If you confident with yourself, nobody can make you feel no kind of way, man. And nobody can make me feel like my YouTube channel ain't successful. Like my YouTube channel ain't gonna be big. Oh, you only getting 10 views. Bro, I was getting 5 views and 10 views like 2 years ago. I've been doing this for a minute. I ain't just started doing YouTube, but now it's catching on. Like, bro, I seen the vision. I knew it, bro. It's gonna get greater later. Like, no one can make me feel no kind of way because I got it in my head that, bro, I'm gonna make it happen regardless of the naysayers, man. So stay strong. You can do it, bro. RRT Posse, man. And when you do it, just come back here, drop them comments, let everybody else know that's reading the comments that it's possible. Why did you choose this career? To be honest, when I said this to people, they may laugh, but I chose this career because I was working at the hospital and I always saw respiratory therapists. And it seemed like they weren't really doing any like hard work. I'm like, I'm already in the medical field. I'm already in the hospital. I might as well go on and get in where I fit in. Let me go on in there. You got to go to school 2 years. Okay, I'll do the 2 years, whatever. It's possible they here. Let me go on and get in there. Man, that program was so, let me see. I don't want to say difficult because it's possible. It was so challenging. Then I got into that work field. Man, that thing was so busy. I'm like, how do they make it look like this? But that's why I really joined, man. I thought it was going to be easy money, piece of cake. How old are you? Oh, you getting personal, dog. How old are you? But yeah, I'm 39th, man. My age is 39th. When I was 8 years old, I was 39th. 39th, that's the 39th is the street that I grew up on as a kid. So I'm forever 39th. When I turn 39, I'm going to be 39th. When I turn 48, I'm going to be 39th. When I turn 25, I was 39th. Every birthday, I'm 39th, so I'm 39th. I don't really know how old I am. I'm 39th. But you tell me how old am I? Please help me with that. Hey, let me see what we got next. The Glam B. What's that in the Glam B? What courses did you take? I'm assuming what courses did I take for the respiratory care program? I took the normal recommended prerequisites. That's your anatomy, your maths. I think you gotta have English, chemistry, microbiology, lab and lecture. So I did the normal prereqs. But what I did was, I knew I wanted to get my AA degree too. So what I did, every class that was required for the respiratory therapy prereqs, I made sure I chose that on the AA transfer degree. So I was like killing two birds with one stone. Chemistry over here was needed over there. I took that chemistry. We needed a certain kind of like history or math. I made sure the math that I needed was also going to be used for my AA degree. Like, you feel me? It was within the same bracket. So that was really like a smart strategic plan to me. I killed two birds with one stone, man. So like, once I got my AS degree, the next semester I got my AA degree. So now I can say I got 2 degrees, then I can go back, I can keep going, I can transfer to a major university. But I don't want to do that, man. I'm gonna stay at the community college till I can't go over there anymore. Till I get my bachelor's there, then I'm gonna go off and get my master's. But right now, the way this Fetty rolling in, man, I ain't gonna lie, like it's hard to stay in school, man. I was in school originally. I was going back for my bachelor's. I was in school. I was taking classes. I was going to classes. And I was on my way to school. They're like, hey, man, you want to come in and work? Bro, what? Do I want to come in and get paid? Time and a half? Overtime? I just came from struggling, waiting for this Fetty? Of course, I'm doing donuts, going back to work. They withdrawing me out of classes and everything, man. Like, it got to the point where I had to get to the riches, man. And that's just the way it is. So one day, I'm going to go back. Maybe I may do something online or something, but the way this money is, man, it's hard to just say no to it. Next question she asked, is there any way of messaging you? Yes. The way you messaging me right now, through the comments. Because it's like, the question you may have, a lot of people may have the same exact questions. Then I'm going to come and do the Q&As. I'm going to answer it and let everybody see it. And if I can't answer your question, somebody else may read your comment and they can answer your question. So that's all with that, man. That's Q&A, second part. Part 2, got my headband on because I'm balling. I'm dropping 2 videos in one day. Like, come on, man. I'm doing this for y'all. RRT Posse, let's stick together. Let's make it happen, man. You know, like, I'm feeling like I'm the realest thing on YouTube right now. Imagine how I feel because I'm so confident in myself. Speaking of YouTube, the next video I'm dropping is going to be what y'all been waiting for, what y'all been wanting to see. I'm going to do that empty house tour. I'm going to take it through the crib. You're going to see how hard work pays off, man. I'm going to take you to the downstairs, the upstairs, the 2-car garage, the pool in the back. That's in back of the back. Hey, man, respiratory therapy. Like, subscribe, share. Tell your friends to tell a friend. We trying to get my page. Let's try to get my channel to 8 million. Just get me to 8 million and I'm good. You get me to 8 million and I'll be satisfied. But until then, I'm going to keep, you feel me? I'm forever grinding and going. Big Money Bound TV. Thanks for listening. I had said, thanks for tuning in. It's not like I said, thanks for zooming, but thanks for tuning in.